Hi, welcome to my video blogs. I'm Jack Zoumaras, and today we're going to talk about one of my favorite topics. It's the anatomy of the face and the anatomy of the aging face. So the face, if you look at the face, obviously you see skin, and in terms of basic human morphology, the actual definition of the face is actually from ear to ear, but not including the ear. If you actually look at a lion, for example, not that you're always looking at a lion, but a lion has its mane of hair covering its ear. So the face is actually between the ears. And the reason why we're interested in the face is obviously that's the area that ages, and that's the area that we want to look younger, look fresher, look better in photos, and look better for our own confidence and self-esteem. Now, the reason why the face ages is because it animates, and I'll go into that a little bit later. But essentially, the face is made up of skin, followed by underlying fat, followed by muscle, followed by spaces where the nerves are, followed by bone depending on where you are in the face. So think of the face as a concentric layer of 5 layers. So the first layer is the skin, the second layer is the fat. We have a lot of fat around our cheekbone, and that's what we call our malar fat pad. We have next to no fat on our eyelids. The third layer is the muscle, or what people call SMAS, which stands for the superficial muscular aponeurotic system. So as I'm talking, as I'm animating, smiling, the SMAS is actually what's moving. Underneath the SMAS, there's a space. In that space are nerves and tendons and ligaments. That space, underneath the space, in the forehead is bone, in the cheek is actually deep tissue, in the neck is what's called deep investing layer. So there's another fascia of the neck. And beyond that, it's not the face. So when we age, the reason why we age is those ligaments, before I'll talk about the facial aging, is those 5 layers are connected with a strong ligament. We have a strong ligament around the eye called the orbital retaining ligament, around the masseter, and also the mandible. And that ligament transcends all 5 layers. If you think about this ligament as a tree trunk, the tree trunk is quite strong, so on the bone it's quite a strong ligament on the ground. As it goes up, it branches, and those branches are analogous to SMAS layer 3. And on the actual tree itself, you have leaves, and those leaves are analogous to the skin. So that is essentially the anatomy of the face. The reason why we have ligaments is to allow the muscle to attach to something, and also to allow us to actually open our mouth, to have holes in our face essentially, so we can breathe through our nose and have eyes in our eye sockets. That's the reason for layer 4 to have those spaces, and also the ligaments are essentially constructed lateral to all those spaces. In other words, lateral to the eye, to the nose, and to the mouth. So as we age, what happens, if you think of the tree falls down slightly, the leaves fall down, the skin falls down, the facial fat moves, the muscle moves, and a ligament waxes and wanes. And at a fixed point where you age is we age around the eye, and we also age around the jowl area. And that can be explained anatomically by those ligaments. The ligaments attach around the eye and around the jaw, and therefore the skin falls around the jaw, and you get facial skin going to the neck, and you get a jowl. You also get hollowing around the eye, and you get bags. And the reason why you get that jowling is that space, layer 4, I said it was a space, basically becomes a bigger space as you age, because all of a sudden everything's heavy and down. And that's essentially why we age. Our eyebrow ages the same way. We have a fascial ligament on top of the eyebrow, and that drops, and our eyebrow drops. Our skin gets loose from just simple aging and also sun damage, and then the fat moves down, and that creates bags under our eyes, as well as the ligament moving down, and creates an obvious junction. You can see even in me, I'm 40 years old, you can actually see the eyelid junction versus the cheek. In a young person, you can't see that area because the ligament is all strong. And as we come here, we get jowling. So, and in the neck, again, we've got loose skin, and we've also get muscle atrophy that moves down to cause loose skin. So you can see the aging process throughout the whole face, from the top of the head to all the way to the neck, is affected because of these 5 layers. And then what we do about that is essentially surgical intervention, or sometimes non-surgical intervention, to reverse those aging processes. Now, the interesting thing about this in plastic surgery is that we only know this intricate anatomy since 1996. Even though plastic surgeons were doing SMAS facelifts, so level 3 deep facelifts, from the 70s, because SMAS was invented by a guy called Pironi in 1976, the actual anatomy of the aging wasn't really known to 1996. So now, by knowing the anatomy, we're able to give you a natural looking facelift, or natural looking eye surgery, or brow surgery, or neck lift, and not reverse the aging, but make you look younger, but naturally. And hence, this is the anatomy of the face, and the anatomy of facial aging is all interrelated with that anatomy.